Dr. Amanda here with StraightSmile Solutions. I'm here continuing our series of lectures about Phase 1 appliances now, my Phase 1 Smile appliances. Thank you so much to BiteSoft and Mr. Ian.withers for giving me the demo models and all these wonderful, beautiful models you're going to be learning from. This is just absolutely fabulous information. If you have any questions, feel free to contact him. I've got his contact information here. He does have distributors in the US and all over Asia. So he is just fantastic. We're going to talk today a little bit more about now correcting anterior crossbites and all the different options that are out there without having to do braces or aligners. So these are options that you can do in the mixed dentition. This is just fantastic for probably, these are all dolled up, really pretty appliances, lots of colors and sparkles. But you can probably, I'm guessing, do these for less than $200 in overhead. This is just fantastic. You wear them 24/7, few months, and you're done. So this is the first one. This is just kind of the OG of the really simple appliances to correct a simple anterior crossbite. This is called a finger spring. If you look under here, there's a tiny little spring that's kind of zigzagged. It's really easy to activate. All you do is just flip it over, give it a tiny little tug, and it activates. And then you can't do too much because it won't seat. But it should be enough that the patient feels some compression. They come back a few weeks later and you activate it some more. Pretty easy. A little difficult to quantify, but it's a really simple design. Okay, so the next one that we're going to talk about is the jack screw. This is getting a little more fancy here. So it's probably a little more expensive, but this appliance basically has a little screw, and not similar to an expander like we've talked about before. You're going to have a key and you're going to activate it probably about one term a week or so, but really depends on, how you want to do it. You can probably have the patient activate it at home. This appliance also happens to have some occlusal acrylic here, so this would be good for kind of an open bite patient or a long face, increased vertical patient as well. So you're kind of killing two birds with one stone. This is not going to fully correct this. There's no way. This is going to have some improvement in the arch development, but it's not going to be a full correction. So, because it's not like a bracket, right? Or an aligner, but you can get a lot of improvement here and at least hopefully get it out of traumatic occlusion and also help with the bite here. All right, let's go on to the next one. This one is extra cool. I've never seen this before. These are pistons that you can activate. And I don't know if Ian has some type of proprietary on this or not, but you can ask him. But he said it's really, really efficient to correct crossbites on the laterals. So reach out and talk to him more about that if you have some questions. I think that's really neat. All right, this one is I call it a Premaxilla jack screw with Facebow hooks. So we're getting super fancy here. So this is an appliance, okay? We talked about the occlusal acrylic already. We talked about that for open bites, for long faces. It's great. It's also for retention. Now we've got a little jack screw that helps to advance the whole premaxilla. That's all 4 teeth here, okay? You turn it, probably about one turn, maybe every couple days, one turn a week. And it slowly starts to advance it and open up the arch, correct crossbites. The other bonus feature you have on this appliance is the Facebow hooks. These are hooks that are right here. You can hook a Facebow or reverse pull headgear to this. That's pretty cool to help to advance the premaxilla even more. It helps to open up the airway, develop the face, correct crossbites, correct traumatic occlusion, just amazing stuff. Now remember, you can only do this in a growing child. You cannot do this effectively or efficiently in a skeletally mature child. So that's why you have to be screening your kids young and correcting these traumatic occlusions as young as possible. So neat stuff. And if you have some questions about Facebows, reverse pull headgear, I'm going to be doing a demo on that shortly. I'll give you about a week. Let's see. And lastly, this is another Premaxilla advancer, just like the other one, with the occlusal acrylic as well. But this one has a lip bumper, and that is cool. Lip bumper is really, really great, especially if they have a strong lip, to help to remove that force, that kind of counter force, to allow this to work more efficiently and effectively. So they're not going to see it. It's up under their lip. Maybe it gives them a little fuller lip look, but it's really going to help you advance this easier. So really neat stuff. Thank you so much to Ian and BiteSoft. Again, if you're interested in ordering some of his cool appliances, you can contact him here. Thanks so much for the content, everyone. Keep those questions coming. And stay tuned. All right, thanks so much. Don't forget to visit StraightSmileSolutions.com, schedule your complimentary consultation, click on our media page to visit one of our live courses. If you want to learn a little bit more hands-on, we do have our hybrid courses, Orthodontics Education in a Bag. These are really low prices to learn hands-on all kinds of features. Right now we're offering straight wire courses, photography courses, courses on elastics and interproximal reduction, IPR, but who knows, we might move on to all kinds of phase one soon too. All right, thanks so much and have a fantastic day.